lot of patients come to your office and they're nervous. Doctor, do I have fatty liver? Yes or no. Do I have severe fatty liver? Yes or no. And do I have cirrhosis? Yes or no. And when they can leave your office and you can answer, no, you don't have to worry about it, they are tremendously relieved. Just on Monday or Tuesday, we had a patient that we found out that she was referred for, fatty liver. And we did confirm that with the Hologic that she did have severe fatty liver, but she didn't have any advanced fibrosis. And that in itself was a relief. And then it's a game changer for her because now, and we told her, if you lose weight, you exercise, you eat right, take vitamin E. And so now she's leaving her office with a tremendous confidence that it's not too late, and then she can intervene and make a change in her life. You don't get that if you send it out somewhere else. And the other problem, and people that are in the private practice know this, is a lot of times you send patients out for a test, and the people do the test and they never give the test result back to you.
The patient doesn't, or the provider?
The facility doesn't give it back to you. They don't send you, they don't fax the labs back to you. They don't fax back the CT scan result to you, and so you have to have office staff that have to check, and you don't have to worry about that anymore. Since you're doing it yourself, you've eliminated that anxiety and tension, on your office staff, because it is a big problem in the private practices. You've got to track down all these results.
I gotcha.
And
so
this is
easier and faster, basically, right?
Oh, easy, faster.
Yeah.
And if you likewise, if you find someone's got cirrhosis, then you immediately activate your cirrhosis evaluation and protocol. And it's having that immediate answers is really important.
What would you say to somebody who's just getting started wants to add it to their private practice, just getting started with it, or wants to get started with it, but is concerned about, what if I'm not a radiologist, what if I miss something? How do you handle that?
Yeah, exactly. I know, we're that's a very valid concern. And I think we know that I always tell my patients, ultrasound's not perfect. If I'm very confident as far as measuring, fibrosis severity and steatosis severity. Now, but as far as, evaluating, what did I miss a cancer? Did I miss something in the liver? Ultrasound is not perfect. I mean, and I just tell people that, it's recognized that ultrasound only picks up 60% of liver cancers. It misses 40%. But I always tell myself and my patients that, if we're worried about your liver, we will get an alternative imaging modality. We're going to get, we're using ultrasound more as a, point of care test. And if we have any concerns about liver cancer or missing something, what do? We order a CAT scan, we order MRI. It's and we do this all the time in GI. And I think people we do this all the time when we're worried about stones in the bile duct. We do MRCPs, we do endoscopic ultrasounds before we do an ERCP. So it's not a new concept to the GI doctors. They just have to adapt it to this machine. If they're worried about something, they can get additional imaging. No one says you can't. So we do tell our patients that, just the other day, in fact, we said, we're going to get a CAT scan. We found something, we need a CAT scan.
What would give you an indication that someone may have something more concerning to you that would indicate additional imaging? Is it the ultrasound image? Is it that the image might not be very clear and you're just not as confident? Or is it something else?
Yeah, I think exactly. That's a very good question. Usually it's someone that there are healthy livers, and I'm not worried about them, but there are people, when people have, very severe cirrhosis, their liver, looks moth-eaten and rotten. We call it heterogeneous, and it's it's got, dark spots and light spots, and it's very heterogeneous. And so those patients, I know the ultrasound is not the best modality for picking up. If I'm worried about a liver cancer, I'm gonna get an MRI on that patient.
Got you.
And so that you sort of learn that. I mean, if they got a healthy liver, I don't see anything. I'm not going to get too concerned. But if these people that got a really, really severe cirrhosis, and you can see that right away on your ultrasound, you don't have
So
to be
it's
a
not
rocket
hard to
scientist.
pick up.
Oh, it's not.
So you're a private office. You own the practice. Whatever you add to your practice is not being purchased by a hospital system. It's coming out of Alan Weston's personal bank or business account. How would you? Ultrasound's not cheap. So do you find, from a business standpoint, it's affordable for you to add, or that you get reimbursement back to where you can justify it, the financial outlay versus the ROI?
That's an excellent question. And being a self-employed businessman, that's the first thing I asked. You get reimbursed for it. You get reimbursed for doing the ultrasound.
Mm.
And that oftentimes that's more than the visit to the patient. And so, I mean, 7 years ago, I calculated all I needed to get reimbursed, to pay off my machine fully, was 20 patients a month. And I'd had the machine paid off in less than 2 years. You do 40 patients a month using your ultrasound machine, shear wave.
To 1 year.
You got it paid off in a year. So it's a no-brainer to anybody that's truly a businessman. It's amazing.
So what kind of patients in your practice do you actually use the ultrasound imaging elastography for?
It accounts for quite a number of our referrals. We have referrals for anybody with abnormal liver function tests gets, in-office ultrasound with elastography. Any patient with abnormal imaging, outside imaging of the liver, i.e. a nodular liver or fat liver, they get the in-office ultrasound with elastography. And then we have a number of patients, about a quarter of our patients are referred by primary care doctors because they're worried about, fatty liver disease and NASH and significant fibrosis because, their patients got diabetes or hypertension or is obese. Yeah. So that's a big component of the practice.
I was asked this the other day by an endocrinologist. When should I refer them out to a specialist? What would you say to that?
Well, I think the simplest is using this called the FIB-4 score, which again is a very simple score. The patient's age, their AST level, their ALT level, and the platelet count. If it shows anything, if it shows, it excludes advanced fibrosis, you don't really have to. But if it shows anything above, that F2 or above, I would definitely refer them because again, these are screening tests, and they're supposed to identify, low risk populations, i.e. the, lack of advanced fibrosis, and the high risk, which is you've got to worry about cirrhosis. And then there's the intermediate group. So anybody's an intermediate group on a FIB-4 or a score or a high risk should be referred for further testing. Okay. And in fact, Paul, it's a very good question. If I have a patient comes in my practice and they're getting followed up, they have Crohn's disease and I'm following for Crohn's, and I go through their past medical history and I find that their BMI is 32. I'm going to offer in-office ultrasonography. If they have hypertension and diabetes, they're going to, it's irrelevant to me what their lab tests showed by their PCP, because I already know that those in themselves are risk factors, especially if they're older. And so we capture a lot of patients, they come in for one problem, whether it's their Crohn's disease or their irritable bowel or, history of polyps. But, we're trying to, but if we see that they've got a lot of risk factors for, non-alcoholic fatty liver disease, we're going to go ahead and jump in right away in their office and tell them about the machine and why it's important to get it done today. The people that were timid before because of, not getting, an accurate reading or spending a lot of time, this thing is incredible. You put the ultrasound machine on the liver, it lights up instantaneously with the whole box lights up, and it's just a game changer.
Dr. Weston, it's a pleasure sitting down with you today. Thank you for all your time. And, we are blessed to have you on our board of advisors for the International Society of Liver Ultrasound, and your contribution to the society and the medical community all around. Thank you very much.
Thank you. And I look forward to some training courses with the International Society of Liver Ultrasound in the future. Thank you.